Bioprosthetic valve failure is a real problem. Regardless of whether the failure results in stenosis or regurgitation or a combination, patients have to face the hard decision about a second operation. However, transcatheter aortic valve-in-valve implantation is an emerging therapeutic alternative for patients with failed surgical bioprostheses and may obviate the need for reoperation. Now in circulation, researchers report on the Global Valve-in-Valve Registry, which included 202 patients with degenerated bioprostetic valves. The core valve was implanted in about 65% and Edwards in about 35%. The good news is that procedural success was achieved in 93% of cases, and improvement in patient functional capacity after device implantation was clear. 84% of patients were classified as being in New York Heart Association Class 1 or 2 after the procedure. Nevertheless, several safety and efficacy concerns emerged, including a relatively high rate of device malposition, a cluster of osteocoronary obstruction events, and a high rate of moderately elevated post-procedural gradients, the latter essentially defining patient prosthesis mismatch. The take-home message here is quite clear. The valve-in-valve procedure is not as easy as it might appear, but is clinically effective in the vast majority of patients with degenerated stenotic or regurgitant bioprosthetic valves. 30-day rates of mortality at 8% and stroke at 2% are not much different from what was observed in the early experience of transcatheter valve replacement for inoperable patients. Safety and efficacy concerns, however, include high transvalvular gradients, coronary occlusions, and valve malposition. I'm Peter Block, and this is a CardioSource Partner.